sector, boost efficiency, reduce leakages, and support the effective implementation of National Health Act. This will improve primary health care delivery, boost immunization, maternal and child health, and promote nutrition. Today's gathering holds profound significance as we convene not only commemorate World Universal Health Coverage Day, but also to witness the signing of a Health Renewal Compact, which signifies a major commitment of federal government, all state government, and our partners to drive a successful UHC. We've heard from the Director General of World Health Organization his commitment and his encouragement and representation here. To you all distinguished guests, you are a testimony to global solidarity and our shared commitment towards advancing universal health coverage. Let me assure you that all Nigeria is fully committed to ensuring progressive attainment of universal access to quality health care for all. It is in our hand. It is our commitment. And I'm glad the subnational are here in full force. National Assembly is fully represented. Any amendment that is necessary, we are committed to doing it. Remove the spider webs. I'm glad NAFDAC too is here. I must say I watch your programs. Doing a good job. Thank you. Thank you very much.
We are retraining up to 120,000 frontline health workers all over the country in a collaborative effort between the federal, state governments, local governments, and key development partners, to be followed by an enhanced deployment to those frontline centers. We'll also make transparent to all government, non-governmental partners, civil society organizations, and citizens the resources allocated, released, and the results achieved over time. And while appreciating the tremendous collaboration we have received from excellencies, the executive governors, the Nigerian Governors Forum, all the state commissioners of health, the state primary healthcare agencies, and the state health insurance authorities, including recently at the 64th National Council on Health, where the sector-wide approach was also approved. We call on all state governments and the FCT to complement the efforts of the federal government in the following specific policy actions: to increase their budgetary allocations and timely release of funds for primary healthcare services, immunization, family planning, and public health, and to make those allocations and releases public, to verifiably fulfill jointly agreed counterpart obligations in cash or in kind in support of the BHCPF sector-wide approach to the state primary healthcare agencies and the health insurance authorities, and streamlining the processes for disbursement and accounting of such transfers, to collaborate in exploring innovative financing options, to expand UHC, especially for the poorest Nigerians, potentially including health surcharges and considering the provision of additional health resources as first-line charge from the state portion of the VAT pool, and expanding the training and retraining of qualified workforce dedicated to service delivery at community levels, primary healthcare centers and hospitals, and for the states to also ensure presentation and consideration of routine data on health outputs, the intermediate outcomes on a quarterly basis in their states, state executive councils, the NGF, as well as relevant National Economic Council meetings. And we also ask Your Excellencies, the governors, to add your strong voice, participating in community campaigns and engaging with our religious and traditional leaders, as mentioned earlier, in all activities affecting health. On our part, we commit to the establishment of a joint coordination and monitoring mechanism in the sector-wide approach, establishing a common database of all health development partner engagements with the federal government and all the 36 states and FCT, as results scorecard to transparently charge progress on a regular basis and hold each other accountable in bidirectional ways to achieve desired results or change course if necessary. Will ensure the preparation and presentation of an annual report of the state of health of Nigerians and the national health system as provided for in the National Health Act to Mr. President, to the National Assembly, to the Federal Executive Council and the National Economic Council, and host the joint annual review so that we can review our performance over time. We appreciate that our development partners for all the intense work that they have done with us in the last 3 months and who have now agreed to fully support the sector-wide approach to provide additional resources to align behind our priorities, supporting the national leadership and strengthening our institutions and systems where possible, and to reorient their technical and financial assistance to the front ends of service delivery rather than to processes and activities. Complementary to the sector-wide approach to address our prevailing human resource challenges, we are determined to increase the production of health workers by increasing the annual quota of our training institutions, and overproducing health workers will ensure that we have enough pool of trained and competent health workers, even if some are leaving, and exploring managed migration programs through bilateral agreements, whereby both Nigeria and recipient countries where our young ones are going on JAPA will find that, in fact, it will be beneficial for them to invest in expanding training here at home. Because as our young ones live abroad, it will be important that our partners also help expand the production of those that are here. Thanks to Mr. President, the federal government is making significant investments in health infrastructure and equipment of our hospitals, provision of critical commodities, and expansion of health insurance, alongside the attention to the welfare of the workforce. That will also reduce the drain of our personnel. With regards to the rising prices of pharmaceuticals, in 2024, on the direction of Mr. President, we are planning to establish a mechanism for pool procurement of critical pharmaceuticals at lower cost with guaranteed quality so that the poorest Nigerians can afford life-saving medications. And in the medium term, as Mr. President has approved the initiative to unlock the healthcare value chain, we will see Nigeria manufacturing an increasing share of its generic drugs, medical devices, and biologicals, such as vaccines over time. This will reduce our dependency on those who are only keen to exploit our markets. Let me conclude by reiterating our collective commitment to deliver an efficient, equitable, and quality health system for all Nigerians, irrespective of their social class. By the special grace of God, the Almighty God, we shall succeed. And thank you, Mr. President, for your leadership. God bless the Federal Republic of Nigeria. Thank you.
Thank you so very much. Your Excellency, Honorable President Tinubu, to the government officials in Nigeria at the federal level, to the state level government officials, please let me stand on existing protocol. As a DP, we are here today together to acknowledge Universal Health Coverage Day, to fulfill a promise to the Nigerian people, a renewed hope agenda that the people of this great country will have access to fulfill a range of quality health services without financial hardship. That we acknowledge that the high rates of out-of-pocket expenditures for the average household is unacceptable. So, the theme of this year's UHC Day, Health for All, Time for Action, is an appropriate theme for Nigeria. To the coordinating minister and the government of Nigeria, the United States government extends our heartfelt goodwill and solidarity to you and your colleagues for your hard work and dedication to advance health services. As my colleagues in the development community have said prior to my joining the stage, health is fundamental. It is a human right, and there is no economic development without good health. We further want to commend the government of Nigeria for moving forward with a sector-wide approach. And we are encouraged to see the collective alignment around the Health Compact, which represents our shared responsibility and commitment to ensuring the health and well-being of all Nigerians. You know, as I look around this room, I am so uplifted by the incredible attendance here today. It is acknowledgement that change in the health sector is underway and that we, as development partners, are a part of that change. I am so pleased to see so many of you caring about the lives of Nigerians. So yes, this is a time for action. Yes, this is a renewed hope agenda. Certainly, and this is definitely the radical reorientation of the health sector towards primary health care. And friends, colleagues, this is a time for Nigeria to take center stage to address the issues of maternal mortality, the high rates of stunting, to ensure that every family has access to good quality care. This is, as I like to term, it is Nigeria now. So, this is also a time of the power of partnerships. I want to commend the development partners in this room, led by FCDO as the chair of the Development Consortium, for the work day in, day out, sometimes on weekends as well, under the leadership of the coordinating minister, to think more broadly, to do more. We know what to do. We know what saves lives. We know that every family has rights to good health care. It is not the what, it is really the how. And under the SWAP, under agreed upon alignment, we will get there together. So, this alignment will create $3 billion in donor contributions over the next 4 years. We will use data more effectively. We will be more efficient in our support. We will be transparent. We will hold each other accountable to the work that we do. It is a privilege, sir, coordinating minister, to be with you, to be on the front lines. And as you always have said, this is a part of us keeping you your job. So we are happy to do that, and we are happy to follow the whole strategy of the New Hope agenda. It is also our agenda as development partners, and on behalf of the United States government, we are aligned with you, we are here with you, and we look forward to our continued collaboration.
Good one. We will be here.
It is with great pleasure and pride that I welcome you all to this event as we commemorate the World Universal Health Coverage Day, which marks a major milestone for the health sector in Nigeria. As we unite in the celebrations, we stand shoulder to shoulder with the global community, reaffirming our commitment to ensuring health for all. It is with great privilege that we host this event, graced by the presence of our President, President Bola Tinubu, GCFR, all global leaders that are here today, all integral in our collective journey towards accessible, resilient health care system in our country, Nigeria. The theme of this year, Universal Health Care Day, it's Health for All, Time for Action. It reminds us of the urgency and necessity of our endeavors. Today, we mark a pivotal moment in our nation's commitment as we unveil and witness the signing of the Health Renewal Pact, a testament to our dedication to transformative reforms in the health sector. With the support of our esteemed dignitaries, the solidarity of our international partners, we stand poised to turn commitments into actions, translating aspirations into tangible improvement in the healthcare delivery system in our country, Nigeria. Later today, the signing of the compact seeks to bring the federal government, all subnational government, as well as our development partners, both bilateral and multilateral, to ensure investment in a shared renewed vision that will result in transformation that we all desire to see in the health sector. Together, let us pave the way for a healthier, more equitable future for every Nigerian. Once again, I welcome you to this important event and thank you for coming.
On behalf of my colleagues, I extend my sincere gratitude to His Excellency President Bola Tinubu, whose presence here today exemplifies his unwavering commitment to the political declaration made by the global leaders at the United Nations General Assembly in September 2023. This commitment emphasizes the imperative for key national action at the highest political level to expedite progress towards universal health coverage in 2030. I also extend a warm welcome to our special guest and all the dignitaries seated here today. The highlight of this Universal Health Coverage Day is the signing of the compact between the federal and the state governments on health sector renewal. This significant act underscores our resolve to take action towards attaining universal health coverage. I express our gratitude to the Coordinating Minister for Health and his team for translating and coordinating Mr. President's vision into action through sector-wide approach. At the Nigerian Governors Forum, we acknowledge that the true measure of our commitment lies in our action. And to this effect, we have just brought here today our Commissioners of Health, Executive Secretaries of the State Primary Health Care and Health Insurance Agencies. I think you should rise up as well for recognition where you're seated. So you can see the full commitment from the subnationals. And I'm glad our development partners are also appreciating this. Please sit down, ladies and gentlemen. They carry our mandate to collaborate closely with the Federal Ministry of Health and ensure that the provisions of this compact are translated into practical and measurable actions. The NGS Secretariat, on the other hand, would provide robust support in tracking and implementing the outcomes of this compact. In conclusion, I reaffirm the commitment of the Governors Forum and remain steadfast in its dedication to make universal health coverage a reality for every Nigerian. Thank you very much.
Another round of applause for our governors. We'll be tracking the development, and we pray that this...
First, I think your presence here, thank you for it. It suggests, it clearly reveals, the basic understanding that the future of Nigeria, for the renewed hope that you promise, that you represent, for that to translate into realized potential, every Nigerian child, every Nigerian mother, father has to have access to basic health care. And right now, they do not. As you may know, Your Excellency, Nigeria ranks near the bottom in terms of basic measures of human capital. For a country of Nigeria's potential and size, this cannot stand. This cannot continue. And that was part of, on a personal front, what brought me to Nigeria. When you see the potential, but yet you see the fact that on a human capital front, Nigeria is ranking so much lower. That was part of what I said, what can we do to help? So that's number one. Second, part of the solution, or part of the reason for this has been that government spending on health in Nigeria is amongst the lowest in the world. So clearly, if you even compare it to the region, your neighbors, it's 0.8% of GDP, as opposed to other countries where it's up to 3-4% of GDP at a minimum. So there's that imperative. But we know that revenues are low in Nigeria, and over time, those revenues have to be built up. But even with the revenues that you do have, the spending that Nigeria does do, there's lots of opportunities. I love what they said, the largest room in the world, room for improvement. And that's where I turn to Your Excellencies, the governors. I think many of you have heard me say before that almost everything that we at the World Bank do here in Nigeria really rests in the hands of the states. And governors in Nigeria are among the most powerful elected officials I've seen in any country I've worked. Really, and the states have a huge responsibility for the delivery of basic health care, of education, of what matters to most citizens. So what excites me most about this, what we're here to do today, is revisiting, kind of strengthening this compact. In a federation like Nigeria, the compact between the federal, the national, and the states, and actually down to the local governments. And we here as international partners are ready to support that. And we want to be part of it, help in what way we can. It will be important to have it be based on mutual accountability, so it's not just talk. So the warning. Okay. So that's the basic thing. We are here to support you, the World Bank, the rest of the international partners. But this most exciting thing, the key is going to be this compact between the federal and the subnational. It is so important for every child, as I said, every family in Nigeria. Thank you.